order. All members are present except for Lonnie. She is excused. I'd like to call for motion to approve the agenda for today. Somebody wants to? Eric. Second. Thank you, Marta. Public invited to be heard. Gang's all here. Good to see you all this morning. A little odd not seeing you sit on this side, but that's okay. New business. John and I have been chatting about putting together the presentation for the city council. We'll be contacting members to see what they like to do, but the agenda so far is to be able to present what we've done with the food table, what's happening with outreach, what's happening with employment. So putting together a short slide presentation scheduled sometime in June. Let you know how that develops. You should see a sample of this prior to the showing to the city council. They did. Eric and Marta. Eric and Marta, sorry. The agenda was approved by Eric and Marta. Did a roll call. Just got to that. Also like to, let's see, this is approval of the minutes from last board meeting. Eric first and John seconds. Thank you. Meals on Wheels is coming. Should be here soon. Christina, that means you're up because the other lady didn't show
That's
up
fine.
yet.
That's fine.
All right, please take it away.
City Council Meals on Wheels. Oh, okay. Sorry about that. Sorry. Good morning, everybody. So we did have the City Council retreat over the weekend. I'm sure Councilmember Popkin, when he arrives, will want to add to it. There was a lot of discussion. I don't know if you all have read the newspaper, but there was an article on the City Council retreat. I think the couple things that stood out for me was that they talked about how to do, and it's all on YouTube if you would like to view the 2 days. They talked about how to reach constituents a little better, a little more effective, how they can maybe listen to people that aren't always at the table. And so that was a piece that stuck out for me. They talked, there was mention about our Housing and Human Services Advisory Board, and just the broad scope of that board and wanting us to maybe take a look at that. I don't have the official list that will be provided by the city clerk's office that will tell us, these are the things to follow up on. But once I have that list, I'm happy to come back and talk with you about that. They also talked about engaging more parents in the discussion, and maybe having a parent advisory council. Early childhood was a focus throughout. Mental health supports was also brought up. But as I said, I don't have anything specific as a follow-up. And I'm sure Councilmember Popkin will have other things to add as well. Any specific questions that you all might have?
Were any senior issues brought up at the retreat that might be of interest?
I think in general, the idea of social services, the idea of housing encompasses our senior population. So I'm trying to I don't know that I think we did talk about the aging population as well, aging in place, really, but the idea of social services as a whole and housing programs, I think that there was a tie there. Human services funding was another piece that came up. That's what I have. Hi. They were just asking me about the city council retreat. So in general, I talked about kind of what some of the themes were that came up as far as social services, economic development, housing, public safety.
You tell them the most controversial things?
No, I didn't. I saved that for you.
I don't even know where that's going.
But yeah, lots of support for the work that we do, definitely in our department.
Great.
So,
Yeah, I might add.
please.
I might add a couple things. One, we actually had a discussion on day 2 with the youth council, who I think we heard from Children, Youth, and Families. I think it was last fall or last summer with the board here. The youth council came to the city council retreat this year. On day 2, Longmont Economic kind of Development Partners group, multiple stakeholders came on day 1 for lunch discussion, or after lunch discussion, I guess. I don't think any major, I wouldn't say that there were any really radical priority shifts that came up, some more clarity, some more strategic direction on a few things. There was some discussion on other board changes and consolidation or adjustments, nothing that would affect the Senior Citizens Advisory Board that at least came up in that discussion at all.
Right.
But there was discussion of looking to potentially combine or consolidate a couple of other boards where there might be some efficiencies in staff time and kind of purpose for what we're looking at. But
I think you did talk about the senior advisory board, just kind of as a model of how the information share out. I thought that was really helpful, just in terms of how this board works and how you work in partnership with your friends board. So I think maybe
complimented you all a lot,
Yes,
and
yes.
I didn't want to flatter this group, but so I wasn't going to go there. But
Yes.
Oh, no, please do.
Yes.
Please.
And yes, just how the Friends boards, because we do have Friends boards in some other areas.
that's true. We
just
talked
how
about with
they-
library and museum as
how
well.
they could
and just
work
kind of the
together.
integration here.
Yeah. So
Yes.
which is, I think, I have seen that shift in the last couple of years. That has been very helpful, just in coordinating, and especially from a management aspect, just to have everybody on the same page has been super helpful. So nothing in particular was called out, John, in terms of food security, and kind of those pillars that you and I have talked about before. The council did do some work around kind of looking at their vision statement, and doing a little bit of wordsmithing there, but I think there's just going to be some continued work on that, as I understand, and we'll be looking for those outputs from the session that'll come to departments to say, okay, work on X, Y, and Z.
Well, not specific to food security, I will add there were some more intentional discussions. One of the first times I've heard it really this intentional with this group or even the last group, on not only systems thinking,
Yes.
And understanding the unintended consequences or benefits of certain decisions, and approaches and projects, but also kind of what a resilient community really looks like. And so while we didn't call out food security in particular in that discussion, we were thinking about resilience from an environmental, economic, and social standpoint, where you could certainly see food security fitting into that conversation.
Absolutely, and how that ties into what you all talked about on the first day in terms of getting people to the table that may not always have a voice. So we have people that come to council on a regular basis. We have people that are part of our advisory boards. But there's still a large portion of the population that the council doesn't hear from. And so what are some creative ways to do that, which I think that through the social support programs that we have in our department, I see us helping to convene some of that possibly down the road.
How does the representation from the advisory board get invited to the retreat next year?
I think that's a great question, and I think we could probably make that happen.
That'd be wonderful.
Yeah, we've definitely heard from different constituencies over the last couple of years, and I think that'd be very welcome.
Wonderful. Put it on your calendar, everybody.
Noted.
Noted. Thank you. Let's see.
I'm bringing the message from my son-in-law, who is a technology person.
Okay.
So I'm just prefacing it with
Sure.
that, saying that he has suggested that, and tasked me really to bring it up with you all, just to kind of get it going, that perhaps the city ought to consider getting a technology advisory board because of all the controversy that's going on right now with the traffic cameras and all that sort of thing. And he's following that much closer than I am. After having a discussion over breakfast a couple of days ago, he kind of came around saying that, well, maybe it would be good if the city would consider getting a group of advisors to help them on some of the technology, because none of you are experts and these individuals would be, and they could give you some things that might be useful. His concern was that some of the decisions that are being made to go with certain vendors are not being looked at in depth enough. And I'm not going to bring up any of the controversy or whatever, and you all know what I'm talking about. But he thought maybe the solution was to get some people who knew what was going on, and they could give you the inside view of what,
Sure.
to help your decision making.
Yeah, I appreciate that. That's helpful feedback in two regards. One, very much aware of what you're referring to, and there's a very rapid technology is very rapidly evolving right now,
Yes,
especially
exactly.
with the integration of artificial intelligence and different data management systems. So we're very actually quite aware of that, and we do have many staff who are digging into technology. From a policy making standpoint, I think that's a great idea,
Right.
and it's something that was actually floated very intentionally.
Be a way of filling in some.
One of the, we were talking, I mentioned board consolidation. We also talked about creating new boards
Right.
to serve new needs. Actually, one of them was related to technology and data management.
Cool.
So tell your son-in-law that feedback has been received, but also that was something that I heard in DC from some communities that they were starting to do when I was at the National League of Cities conference in mid-March. I went to multiple public safety and technology sessions as well, and one of them was, it wasn't just a community advisory board, it was really thinking, and it wasn't just on public safety, it was really thinking about how technology is going to be integrated or already is integrated into so many aspects of.
Well, it's the use of the data that's gathered and then the overlying artificial intelligence. It's could be very alarming, could be.
Absolutely, and I will say just on the topic that you're alluding to on public safety and technology here, how the data is governed or managed is something that we looked at very intentionally on this.
Yes.
And is materially different in terms of the direction we're going with in significant ways than where we were before. So I think your son-in-law and his concerns and that from others was very much received. And once we dug a little bit deeper, we realized there's vast differences in who does what and how. And the provider we're going with right now on that specific technology is someone we've worked with for over 7 years already and has much more sensitive data than what they'd be collecting from this.
I will give the information back.
Sure.
I appreciate it.
Yeah, and if he wants to follow up with me directly, feel free to pass along my contact information. Yeah, thanks, Tom.
Well, being a technologist, he doesn't like to be he's not a public face,
Sure.
but he's deep thinking about what's going on, and he's very much into the cybersecurity and,
Sure.
and all of that sort of thing, so he keeps up with what's going on.
Glad to hear it.
Yes.
I've got a question, or I should say an observation I was going to make under the mention it because Matt was I might
We
have
started at 9:30, right? Like I was only like 3 minutes late, right?
Right on time. It's off really fast.
This wasn't at 9 o'clock. was
Ready
it?
to go.
Okay, good.
Tis.
Like this wasn't at 9 o'clock, was it?
I might have misheard, which is entirely possible. Under your report, it says, recent changes to final approval of board interview process will not be accepting board members' recommendations. I thought that had changed. Did I misunderstand that?
Yeah, I was going to provide an update on this during my liaison update, but let's go for it now. So
Can wait, if that's part of your report, like Katie Weiser is a
great.
speaker.
Then let's come back to that, Dave.
Yeah.
Okay.
Let's not
We
forget
can
that.
very much clarify that for you. Thank you.
Katie, good morning.
Hello,
Welcome.
everybody. Thank you for having me.
It's been a while. Good to see you.
Wow, yes, thank you. I'm Katie Weiser with Longmont Meals on Wheels, and I'm the Communications and Development Director there. But thank you all for having me today. So I'm just stopping by to give you some updates on our program. I think most of you are aware of us. But just to be sure, so what we do here in Longmont is our primary goal is to serve ready-to-eat, hot, nutritious meals in the homes of folks who are homebound in Longmont, Niwot, Hygiene, and Lyons. And folks who are homebound are people who are older, people living with disability, or people who have a short-term or long-term illness. And while we're there, we're also checking on folks every day as a wellness check to make sure that they're doing okay and that everything is as it should be. It's important to know that while there's recognition with the term Meals on Wheels, we are independent. All Meals on Wheels programs are actually independent from each other. So we're literally your Meals on Wheels. There is a Meals on Wheels of America, but they are a lobbying and research organization. They're not even a parent organization. So we're all independent from each other. And so as a result, since 1969, when we came into being, we have tailored our program to the needs of Longmonters and Niwoters. And so that makes us part of the fabric of the community. So 84% of what we do is that home delivered meal. Last year we served more than 134,000 meals. Yeah, that. To 1,533 people. It makes this the largest meals program outside of the immediate Denver metro area.
In the state of Colorado.
In the state of Colorado, yeah. Yep, we're larger than the Fort Collins Meals on Wheels, larger than the Grand Junction Meals on Wheels, larger than the Colorado Springs Meals on Wheels, and that program is the entire county. So, yes, we're doing our thing here. We also don't have waiting lists and never have. We also, in the last year, lowered our prices instead of increasing them, and we're the only ones who have been able to do that as well. That's also really important because we noticed that, we do charge. We try to kind of line it up with people's abilities to pay on our sliding scale. And when people miss bills, we give them a call and chat with them. And around this time last year, our program director was making a lot of phone calls. And so we had an emergency staff meeting and talked about lowering the low end of the sliding scale. And so we've seen people struggle more in the last year, and we're really trying to kind of step up and help those folks out and do what we can for people in need. So yes, in addition to that ready-to-eat prepared meal that's prepared right here at the senior center, we are doing that wellness check. And that wellness check is an important piece. The first thing we're looking for, first and foremost, is that the client comes to the door. or they've left a cooler with an ice pack in it, which is a code to us that they knew that they were going to be out for a little while, but that they're doing well. If those two things haven't been met, we start to worry. And we start by calling them. Usually they just didn't hear somebody at the door, or they were in the bathroom or something like that. Every once in a while, we'll have to go down to emergency contact, who will say, sure, I'll take over from here. I'll check in on her. I'm sure she's fine. I'll let you know. We also call local hospitals and see if anybody's admitted. And if nothing comes from any of this, we will then call for an emergency wellness check from the fire department. And we'll go out and try to check on them and make sure that they're doing okay. That's the first part of the wellness check. The other part of the wellness check is that we try to keep the same delivery driver volunteers on the same routes week after week, so that they really get to know that participant as well, so that they can come back and say, I know she's always a little confused, but she's more confused than usual. Could you give her a call and see what you think? And so we can catch kind of declining health as well that way. And that in particular is something that our alliance with senior services here is really important, because we do share so many clients, and we can be that daily check-in for a lot of clients that senior services is regularly working with, and they can come and ask us if we've noticed anything different, and vice versa. And then if we have noticed things, we feel like senior services needs to be involved and not just family, we can reach out to Brandy and the team here as well. And so that relationship runs both ways with that wellness check as well. We rotate our menu every 3 months, except for a handful of very popular items. And we do this in an effort to try to hit everybody's taste palette. We want to hit a variety of ethnic needs, a variety of meat versus vegetable needs, and things like that. We do offer some special diets, especially those for some illnesses and cultural and religious needs. But folks, we publish our menu a month in advance, and what folks can really do is they can look at the menu a month in advance, and they can call us and say, I don't care for that, I'm gonna skip that day, but I really like that, I would like 2 on that day. So we do try to ask for dietary preferences, that people who are cognitively able manage their own dietary preferences, but for allergies and things like that, we'll kind of step in and help. And then, of course, for religious and cultural preferences, we'll step in and help as well. Handful of menu items are just too popular to wait 3 months. But we try really hard to have a very good rotation to kind of hit everybody's needs. We also serve lunch here at the Longmont Senior Center, and that is for folks 55 and older and their guests. And we do that not on a sliding scale, but on Monday and Tuesday and Wednesday. Those meals are, the first meal is free, and each subsequent meal is $2. And they can take a meal to go if they'd like it for the evening as well. And then on Thursday and Friday, all meals are $2. We also have a salad and soup offering on Thursday and Friday. So the reason that the pricing is different there is because after the pandemic, folks were really reticent to kind of come out and recongregate. But that's another thing we want to do. We want to help alleviate any isolation. A lot of seniors in Longmont live alone, and so we really want to encourage them to use the senior center. And so after the pandemic in particular, it was hard to get folks to come out. And we had tried some various kind of normal marketing avenues, and we decided to create some good old-fashioned word-of-mouth buzz, and we could definitely see that was it. And now we are hitting capacity some days. So yes, it is very busy, and for some people, they don't like that. Of course, we still encourage people that the whole point is to come together in community. But yes, it's for some people it's a little too loud, and so we do try to have overflow rooms on some days of the week that it's a little bit quieter. And that's also then why they can take a meal to go if that's just truly their preference and we can't convince them to hang out with us, and then that's okay. So that's what's going on here at the senior center. So right now, we're very busy. We are doing about 475 to 500 meals per day in home delivery, and about 85 to 100 meals in-house for folks that are eating here. Which means there are now a handful of days where we are at capacity, holidays in particular. Most days we're doing okay, but some days we are at capacity, and so we're kind of having conversations with amongst staff and our board and the city, and trying to figure out what to do and where we need to scale back or where we could possibly expand. And so our priority will always be those homebound, isolated individuals, and it has to be. And so we will do what we can to support the program here at the Senior Center because it is that offering for community. But of course, the Senior Center is a hub-in place again post-pandemic, so it's not like we're trying to pull people in any way we can, like we were after the pandemic. So we'll keep on working at it and figuring out where we can kind of nudge the numbers, because if you've ever joined us on a holiday, you know that. Yes, and our home delivery folks know too that like things are getting delivered late on those days and things like that. So we have to kind of look at where we can nudge capacity a little bit here and there. Yeah, so we'll keep on working on that. We have some support programs as well. When we are doing those wellness checks, the City of Longmont attorneys err on the side of privacy when it comes to emergency wellness checks whenever police and fire are involved. And that has been since about 2014. Our city attorneys really wanted to err on the side of privacy. And what that means is that when we call for an emergency wellness check from emergency services, they have to use probable cause as the determining threshold to really more than break down a door. They cannot walk around the perimeter anymore. They can't look to see if a door is already unlocked. They can't look for unlocked windows. Probable cause is hearing somebody call for help or really kind of smelling something that's off. It's not newspapers piling up. It's not meals piling up. It's not the TV blaring at all hours of the night. That does not meet the threshold for probable cause. So at that time, we started a program called the Lockbox Program. And it is a joint program between us and the fire department. And what we do is we provide a very secure lockbox, one that realtors use. And the fire department goes out and affixes it someplace solid on somebody. So not on a doorknob the way a realtor would do, but on a pole or on the side of their house, something like that. And they keep the code for that, not us. So we don't have that. It is in the secure CAD system with the fire department. They do have to fill out some paperwork with us and sign some waivers with us. And that lowers the threshold more to what we think of when we think of calling 911 when you haven't seen your neighbor in 4 days, to where with reasonable cause, if they're concerned about your safety, that they can break down the door and things like that. And actually, Friends of the Longmont Senior Center will often help cover the repair costs on a door in situations where it's just, we really needed to check on this person. And so, yes, that's also a really important partnership we have here at the Senior Center. And so the advantage of doing it with the fire department in addition is that, yes, then you as a neighbor, if you call on the weekend when Meals on Wheels is not out delivering meals and say, gee, I mean, I see her every day, this is so weird, the fire department can look it up and see if they have a lockbox with us. And then they can kind of go out and check on that person person and gain entry to truly check on them. And so it's a really important program. And we actually offer this program now to folks even who are not receiving our meals. And so they can be kind of a faux client of ours, and we'll store the paperwork, and then we're available really for neighbors and fire department to kind of check on folks, not us when we're delivering a meal. So that's a really important one. Another important one that I don't have a flyer on because it's for our clients only is our pet program. I can't tell you how many times we've gone out on a wellness check where somebody really should be seen by emergency professionals. And emergency professionals come out and say, you really need to go to the hospital. And if somebody doesn't have a plan for their beloved pet, if they live alone, if they don't have family nearby, they're more likely to say no because they just, what am I going to do with my pet? And so Safe Shelter and us, we have a program with Longmont Humane Society where we keep a fund of money set there for those situations where then they're technically become the pet, the ward of Meals on Wheels, but they're cared for and housed at the Longmont Humane Society, and we cover those expenses with the fund that we have sitting there. Because that's a really heartbreaking reason for somebody not to go there, because it's a sign of their true isolation. And here we are, the lifeline to get them support, and they're too worried about their pet, which is understandable. Yeah. So the other program we have that I've kind of hinted at is our Project Homecoming. And this program is available to anybody in Longmont who's returning from hospital stay, outpatient treatment, dental surgery, rehab facility, whatever the reason, whatever your age, whatever your socioeconomics, you can get the first 5 free meals for free as you're coming home from a hospital visit or inpatient treatment. After that, we'll put you on the sliding scale for our home delivery. And if it seems like this is more of a long-term health issue, we might ask you for a doctor's note if you're under the age of 55. But again, the doctor's note we're not a HIPAA environment, so the doctor's note is just this person would benefit from meals and they struggle to stand long enough to cook for themselves is kind of the standard we use, that you struggle to stand long enough to cook for yourselves. And so this is a wonderful program, both because it's available to everybody, and it's amazing how often people underestimate coming home from the hospital. And so they think that they have a plan for all the things and food, and sometimes they do, and sometimes it might be for the first week that a family member is coming to stay with them. And that's okay, we can take over after that family member. It doesn't have to be the moment you come home, if a family member leaves, or if you had made a bunch of meals for yourself, but now you've run out and you're surprised that you're still not back on your feet, you can call us then as well. And so that's the first thing that's really great about it. The second thing that's really great about it is I think because, again, there's like a double-edged sword with the recognition of Meals on Wheels. Some programs are quite institutional, especially if they used to take federal funding. There's a lot of very strange rules around the old federal funding. And so as a result, the meals can start to taste like 1980s school cafeteria food. And so this is a great way for people to try it. And we find that 60% of older adults who try it through this program end up staying on longer. And so it's a really great way of just trying it. And the senior center is a really great way of trying it too.
Can we pass this around?
Yeah, or they can sit here, whichever, yeah. But thank you, I like that idea. So I do have the general brochure, which has everything in it. But if you do have those friends and family members who hear the word Meals on Wheels and they're like, oh, that's not for me, the Lockbox program and Project Homecoming has its own standalone brochure because, again, it's a little bit of like lowering of barriers, feels less stigmatizing than the term Meals on Wheels. And so if you take whatever brochures for whoever you're concerned about in your life, and so we're also always looking for volunteers. We're a volunteer, very heavy program. We now have 30 routes around Longmont and Niwot, and then we work with LEAP to do the lines and hygiene program, so we don't have to worry about that one quite as much. And we try to keep those routes to about an hour to an hour and a half, so somebody could potentially do it on their lunch break. But that means we need 30 volunteers in home delivery a day, and we use about 5 to 6 volunteers.
Unknown caller.
And so, yes, we're always looking for volunteers, and then we're always looking for substitute volunteers. We do, of course, do background checks on all of our volunteers because they're serving a vulnerable population, and we want to be really cognizant of that. But even as a substitute, if you can kind of commit to a month or two, especially over, I mean, volunteers tend to go on vacation too. And volunteer vacations still tend to coincide with like school-age children. They do. People like to take vacation with children. I mean, I have to take my vacation with children. I don't know why people choose. I'm kidding. She's lovely to take vacation. But so yes, I mean, always we need summer substitutes and kind of like December, January holiday substitutes. So even just committing to that, if you know you're going to be in town, that's wonderful to us. We do like you to like commit to it a little bit since we do cover the cost of those background checks, but we're not going to hold you down and force you to be with us forever. And we try to be really flexible about it. And then we try to keep our regular volunteers, like I said, on the same route every week so they really get to know clients. But our substitutes, of course, will roam around as needed just to fill in. And then our kitchen volunteers, that's a little bit more of a bigger commitment. It's just really difficult to separate the tasks in the kitchen out. And so that commitment is 8 a.m. to about noon one day a week. And that is mainly packaging, right? We do have a mix of professional and volunteer folks in the kitchen, but because we're in a small kitchen facility, a lot of things come parboiled, par-baked, close to there because we're doing so many meals in such a small space that it becomes really kind of packaging and serving, and then we have to use food grade sealable trays. We are part of the Boulder County Health Department. We are a commercial professional kitchen, and so we fall under the purview of them. And so everything we use has to be commercial quick kitchen, including our tray and sealing system. And so that is a volunteer activity. And then serving here at the senior center is part of the kitchen volunteer duties.
Are all the meals prepared here?
Yes. Yeah, very rare instances when we'll, to cover kind of staff vacations, we might order from, Jersey Mike's or Breakfast Burrito Place, but just to kind of cover staff vacations. Or if, every once in a while there's equipment issues and
I was just going to say, if this kitchen goes down.
yes, and then we have to kind of,
There are backup kitchens?
no. But we have close relationships with various restaurants in town who portion things differently for us, and for the bulk order give us discounts and can try to keep it to about $5 a meal for us. And so, so on our sliding scale, it costs us all in per meal, and that's including the support services. It's about $10 per meal, and on average, what we're getting from a client is about $2 per meal. And we've never taken federal funding. I mean, federal funding doesn't exist for Meals on Wheels programs as of the last year now. We all fall under the purview of the Older Americans Act, which is a dinosaur behemoth piece of legislation that has been kind of like, instead of redone, just like added on to, and it's difficult. There was only about a third of all the Meals on Wheels programs across the nation taking federal funding at the point that the Older Americans Act the funding was pulled from it last year anyway, but it pulled all of us into the same funding stream. And again, like really anytime there was a rumor of changes to Medicare, Medicaid, or Social Security, we would see huge bumps in people signing up in anticipation of like figuring out what the community resources were to support them if it did happen, and then most of them did see cuts in addition. So that's a good thing that people were vigilant about it and working on finding community resources to help them out. So, and then of course with the research that John has done, we also know that the cost per meal is the highest in Boulder County than the rest of the state. Yeah. I can tell stories, but I also, if you all have questions and would like to discuss anything, I want to give time for that.
Yeah, I'm curious, what are you seeing as far as trends year to year, increases?
Yeah, increases. And, it's really interesting. Before the pandemic, we served quite a bit more people, but Well, now at this point, we have blown away the numbers even of 2020. But what we're seeing now is that there's fewer people necessarily, but a lot more meals. So folks need us more intensely now who need us. We had a lot more casual usage before the pandemic of people who would just call us 5 days, a month and be like, ooh, I really, I'm never gonna make this for myself. Could you deliver it to me? We see a lot less of that now. It's really more the other way around, where people generally get at least a meal every day and call off on the days that they truly don't like the meal, whereas before they would call us as well on days they really like the meal. And we're not seeing that as much. And so not as much casual usage now. And we're also seeing, we serve frozen meals for the evenings and weekends for folks that don't have any support locally, don't have the money to, prepare, a can of soup for themselves or anything like that. And we're seeing more frozen meal usage right now too, of folks who just really need all-encompassing support right now.
Katie, before I ask my question, remind the board that when we started the exploring the food table, the first person we talked to was Katie. And she directed us, other people, to give us information that created the food table to begin with. And we went to the city council last year to make our pitch about food security. Katie showed up there and spoke on our behalf. Very supportive of the senior center and what we're doing with the food table.
Mm-hmm. I see us really as working hand in hand. I really cannot tell you how special the relationship is between the caseworkers here and, again, our daily wellness check. Our neighboring Meals on Wheels are not located in senior centers anymore, and in Loveland, they have to have their own case manager on staff because they don't have the close relationship that we have with the senior center here, and it just makes such a difference. I can't tell you how much we just kind of walk back and forth to check on a client and, are you still working with this person? If not, could you again? And vice versa. Like, I haven't heard from this person. We were supposed to have an appointment. Have you seen her? From you guys. So, yeah, I think the relationship here between Meals on Wheels and the senior center cannot go without being very heavily stated.
The question is, I delivered for a bit, and we're told, if you see anything untoward, this a few years ago, but it wasn't a wellness check per se. Is that something new, or has it just become?
Well, yes, it's kind of that daily well-being check that, again, you're coming to the door or that there's a cooler out. And then that, yes, if you see something that is markedly different, if they're just older and isolated, it's okay. But if they seem different, then yes, we do want to hear back about that. But for sure, the missing cooler or not coming to the door, but I will tell you some routes, especially at apartment complexes where there's wraparound services, we wouldn't have that high of a standard because there's not case support there, but there's staff there that are aware of clients who are just kind of more isolated than others and are checking on them in a way as well. Especially with how Longmont Housing Authority has gotten more robust over the last year or two. So yes, some clients we know that we don't have to worry about because of where they're at. Because you could have been on a route like that. And also there are clients who still don't want a lot of interaction for whatever reason, and as long as they have a cooler and an ice pack out, you might not see them.
Well, I was told specifically to wait for one man to come to the door to check on him. They
Yeah.
did say that. That was somebody here in the kitchen said, would you mind just waiting until he answers the door? I was stood out there for 10 minutes.
Yeah.
He finally poked his head out, put his hand out, took the meal.
Right.
It was really rewarding to do
You
that.
saw it?
I did. Thank you.
You might have covered this, and if you did, I'm sorry.
That's okay.
Is how many, I don't know how to ask the question, how many people need services, or they're disabled, or they're homebound, or whatever, and they don't have services? I guess the impression I'm getting is that the need is pretty well met
I hope so.
out there.
Right? I hope so.
And the people that are left out, so to speak, are kind of the exception because you've got good coverage.
Right, yes. Of course, there's nothing that can replace if you live with a caregiver, of course. That's amazing. Now, we can, if both people are older in the home, we have a number of people where somebody is really kind of the caregiver for somebody else, but if something were to happen to the caregiver, or if they would need to be out during running errands, sometimes it's just caregiver peace of mind that we're doing meals, not necessarily based on like an inability to prepare meals, and that's okay too. There's a wide variety as folks age as to why they might need meals, and we try to be cognizant of that. But yes, we try really hard with our marketing. We try really hard. Megan, our program director, kind of sits down and at least once a year with Brandy and her team, like, where are you seeing a lot of need? Are we hitting the same areas? Are we missing each other's areas? You know, and try to really kind of outreach areas that the other might be missing. And then kind of just looking at a general map as well. We have a mapping software so we can see where there's just like areas that are blank and like dig into that a little bit deeper and see if we need to do marketing there. And then with how robust LHA is getting, that's really helpful as well to be able to kind of target those buildings or just buildings in general where there's higher populations of seniors. There's a lot of independent living facilities that don't have kitchen services. And so that's a great place to start. But also we kind of like, we have some institutional memory with how long, the longevity of our staff. And so just to be like, why has this part of town gotten so small? And so then we do some targeted outreach there and we take out meals and we do chats. I certainly hope nobody is falling through the cracks. And I think that senior services and our program are robust enough that I hope that folks who aren't using our services are by choice. And then there's some stigma, and that I cannot tell you enough how Project Homecoming really helps with stigma, because we all come home from outpatient services and hospital services. Everybody does, at all stages of life. And so to try us out for that way really reduces barriers to stigma. That's not a very complete answer, but all I can say is we work really hard to try to find everybody we can.
Sounds like you're doing a pretty good job.
Do the brochures also, do you have them in Spanish?
Yes,
Yeah.
they went around.
And also, do you find in the Hispanic population having, problem communicating to you to them or them to you?
We have staff that speak Spanish. Yes.
I don't know.
They were kind of in with everything.
Oh, really?
I just went down on this. We do have staff that are bilingual, bicultural. And then, yeah, I will tell you that I think the usage of our services here at the senior center among more minority populations, I think, is really helpful, because I still think, like, yes, it's a longevity thing, but I still think that the program here is the best way of trying our meals and feeling comfortable when you need to use this in an emergency. And so the more robust and diverse the programming is here at the senior center, and then through our varied menu options, I think that's really reassuring that, and we see the numbers kind of stay on par as to, our percentage population versus the citywide population. And so I think that's reassuring too, but we do work at it really hard and make sure that folks have bilingual brochures and the website is bilingual and as much as translated as makes sense. Yeah.
Because there's some women, speaking for them, that, are able to help out. But you're less in cases where there's a problem of communication, trust with whatever that. I'd be willing to volunteer.
Yes.
No problem, just call me.
Thank you, I appreciate that,
I
Marta.
think we need that.
I think I have your phone number, Marta, but let me get it from you just in case. Do you have a pen with you? Can I slide this down for you to write your number? Yes. Thank you. I appreciate that, Marta. And I always tell Jerry in particular to check in with you every once in a while and make sure you have brochures, because I actually know that you do that. I actually know that you do that, and so I appreciate
So
that.
there could be more of us.
Okay.
That
Thank you.
are valuable to do just that.
Thank you. I appreciate
To
that.
make the people feel comfortable.
Yes, I'm always looking.
I'm able to communicate.
Yeah, I'm always looking for folks like you to kind of just be ambassadors of our program and help to, because there's nothing like that word of mouth, right? That word of mouth, trust, communication, nothing's ever going to replace that.
Katie, somebody's been directing people that come to the cafe to the food carts also as they come out of the cafe. Have you noticed that? Little carts by the door. Should come out down the hall. We'll put a big sign.
Oh, good, yes, excellent, yes,
Yeah.
yes.
The friends are the ones that put that together. For
That's
us.
good, yes. When we do, it's tricky because again, we're a commercial kitchen. So when we take food donations, for us to be able to use it to prepare a meal, it would have to be enough to serve 600. Right, like that's a pretty high standard but again, our volunteers kind of get to know a lot of the clients on their routes and they will come back to us and say, I don't think she has a can of soup in there. And so we do usually keep like a few things that we can hand out. And if we get a donation and there's enough of it to put up a sign for our volunteers to take it to anyone that they need, we will. If it's just a few things, we add to it there because yes, that's a great location for folks to be going.
What we find is people come out of the cafe and then they kind of shop through the carts. And we're offering a variety of, there's snacks, soups, stews, chili, tortillas.
Perfect.
Yeah. There's dried beans and rice and things, mac and cheese.
That's good.
Just cartons. It's all shelf stable.
Yeah.
So if people want to take that just to have,
Yes.
for their, whether it's their dinner that night or over the weekend or
Yeah.
whatever.
Yeah.
Yeah,
It's really nice.
The carts are now like 95% gone at the end of the day.
Yeah. Yeah.
And Denise and I see to them that they get filled every day.
Oh, that's good.
So it's,
That's good.
How many
Yeah.
pounds of food are you doing now, do you think, per day? How many pounds of food?
oh. John, you say I'm underestimating, and I think you're right. I think we're up to like somewhere around 30 pounds of food a day.
There you go.
I yesterday specifically loaded about 40 pounds of food, and I'll see this afternoon how much of that is gone.
Yeah. Yeah. That's a good experiment.
Yeah.
That's working well. That along with the food table is doing very well for seniors that come in
Yeah.
here.
Yeah.
Mm-hmm.
Another way, how's your way of recruiting funding or people that are well-to-do that want to donate?
Mm-hmm.
Whatever,
It's-
whatever.
I know, tricky. I will say, about 40% of our funding comes from individual donations, which, as you know, is remarkably high as a percentage for an organization. And so again, we're able to lower prices when our neighboring Meals on Wheels are increasing prices because of the support of individuals in the community. We cannot do what we do without individuals supporting us, and that is primary. And then the rest comes from some of the competitive city and county funding, and some private and public foundations, and then a little bit of service fee income. So yeah, and then investment income during, when things had really recovered about 10 years ago, we invested heavily, and so without investment income, we would be in trouble right now. We're getting about $100,000 per year off of investment income, and so there are years that we do not break even without it. So yeah, really important to it's a good thing we had a fiscally conservative board that really, during the flowing times, invested that money, and we're able to kind of live off of it right now when we need it.
You're living off the investments or the capital, do you know?
Just the
Return on your
just the
investments.
maturity of it, yeah.
That's great.
Yeah, we're not dipping into the principal.
Good for you.
Yeah. So yeah, figuring it out, but yeah. Really though, the importance of individual donations cannot be understated. It really is because of the community support that we can do it.
I have a little bit more question about the lockbox. That's available to seniors, or is it broader than that?
I think it's broader than that. That's a great question. I think it's homebound, isolated folks, whatever that is. And if you have if you have a family member that has the key to your home, you can also call the fire department and tell them who your key holder is.
Really? Didn't know that.
They might want you to fill out our paperwork,
Sure.
because again, we're lowering the threshold for them to be able to enter your home. But I'm pretty sure that in years past, I mean, I'm sure that their policy changes, but at least in years past, we've heard from them that they'll put in the CAD system who has a copy of your key. I don't know if they're doing that right now, but they have in the past.
Great. Any other questions for Katie?
Thank
Okay,
you all.
thank you.
Say hi to your mom.
I will. My folks chose to retire here. My dad's last job was here, and then they knew they were gonna stay, so, yeah.
And then they traipse across the world.
Well, yeah. My dad's health is not, as robust as it used to be since his accident, so, yeah. They're here and they're doing their thing, and they'll retire here, and, yeah. My husband says we're retiring here too, so.
That's a great idea.
Thank you, Katie.
Thank you, it's good to see you.
All right, Ronnie, manager's report.
So attached to the board packet is HB 26. Just wanted the board to take a look at it, provide any feedback. Well, if you had any feedback, send that over to John so we could move that over to, it's okay to say Sandy, right? To Sandy to make recommendations to City Council on behalf of the advisory board. So just, you don't have to provide that feedback now, but just add it into the packet for your review, and if there is any feedback, send that to John, and I can work with John to move that forward.
Yeah, that's fine.
Staffing update. We do have our 2 vacant positions filled. We have hired Laura Gaxstatter as our therapeutic recreation coordinator, and then Irvin as our office assistant position, front office position. And we have had great feedback
He's great.
from Irvin. He's been here a little bit longer than Laura. Laura started a week ago, about a week and a half now at this point, right, Bianca? Just still trying to really get acclimated to her role. She was with Recreation in a capacity working with their scope program. So she's very familiar with that side of the services we provide to our community, and now just kind of learning our senior services side. It'll be a great, easy transition just once she learns how we do things here at the senior center.
Does she have set days that she works at the senior center?
She does, and those days, our on-site days are, and I just had it written down, and hold on, is it Wednesday and Thursday, Bianca? 2 days out of the week, and I can get that back. 2 days out of the week, and then a half a day. We get a split a day. And so that's typically on Thursday. I know that day, that half day is the Thursdays, typically split with us. Unfortunately for her, it's a meeting day for both locations, so that's a fun day for anybody, right? I'll say that. But both of them, again, just have the support they need. Our team has done a really good job checking in on them, giving them the tools they need to be successful. And it's fun to see everybody run once they have that knowledge and information. Update on our Elder Exchange. We are moving forward with the Elder Exchange. Yay. And so we are hosting here in July, mid-July, working on those details, all those specifics. We have some, looking at a couple different dates, but I think we are going to land on, I didn't put it in here because we didn't have that information yet. Looking at July 15th through 19th. Really model that same format from last year, arriving Wednesday evening, giving us Thursday, Friday, Saturday to spend time together, and then at that point heading back to the reservation Sunday the 19th. So we're in the early stages of planning and coordinating everything, but again, we do have we have confirmed that we are moving forward with the first part of the exchange. We're exploring the second part of the exchange still, which would be visiting the reservation before it gets cold. So working on all of those things, and again, when I have more information, I'll report out to the board and the Friends board, so both boards as well. AAA community conversations. I don't know if this was in your report, John. working with Triple H to, the AAA to schedule community conversations for interested participants in the Longmont community in the month of June. So what they are doing, their approach for the community conversations is looking at multiple sessions to collect that qualitative data. And so what this approach is doing is to really replace that CASOA report, that little packet that we received that had a little binder packet that we received from Boulder County. I shared with the board. Some of the board members, I guess some of you have still were on the board at that time when we received those. Some of you were not. That was not last year. It was the year before,
2024.
right? And so funding for the CASOA report has been cut. So this is the approach they are taking to still collect that data to support, get the information they need to really align current data and current information with previous CASOA data, if that makes sense. And
What type of data? What type of data are they collecting?
it's qualitative. It's qualitative data. So they don't have the funds to really dial in on that quantitative data like we had before with those beautiful charts that Dave loves so much. Just because the funding's not there. So by having this opportunity for community conversations in all Boulder County communities, they're going to really focus on that quantitative data. That qualitative data.
Are they gonna do that here?
So I am working with them in every community, so I'm working with them to organize multiple sessions here out of the senior center, looking at it from all different angles. So our community, our participants have choices and select, to choose from. Evenings, day, and special sessions that are in Spanish as well. So don't have those details yet. Working on that, but just wanted the board to be aware of that.
Yeah, that item's on the agenda with the AAA this Friday.
Yeah.
But not much detail there either yet.
Right.
So-
It's just in the planning stages, and again, they had a chance to reach out to all different communities to really just have us look within our own spaces to see availability, right? Building usage, times, needs, those types of things. And so I was able to provide my feedback on recommendations for dates and times. And once we iron those out again, I'll be able to communicate that out with the board. 2020, and I also want to share upcoming 2026 maintenance closures have been confirmed as well for July 20th through August 3rd. That's just the annual facility closure where we get maintenance in here, facilities in here to do all the fun things they need to do with our facility to keep it looking beautiful. Okay.
I'm sorry, Ronnie, what are the dates?
July 20th through August 3rd.
July 20th.
Yes. And we will be back for our August board meeting.
Yay.
Which I think at that point would be the 5th, right? On the 5th. All right. Any questions?
Yeah, are you full staff now?
We are.
Great. Did you have trouble filling these positions?
We had great candidates for both positions.
Sorry?
We had great candidates for both positions.
Oh, okay,
Yeah. So no.
okay. So that recruitment problem you were having a couple of years ago kind of passed a little bit?
I think the landscape. I think what's happening everywhere, positions being cut. For different reasons, right? I think there's more qualified people searching for positions during this time.
Yeah, you probably got caught up in the great resignation back then.
Mm-hmm.
It was affecting employers trying to get qualified.
Right,
That's no longer.
right. Yeah, so we definitely had great candidates to choose from.
So what I'm really getting at is you're paying people enough so you're attracting people.
Well, the job market's changed, Dave.
I'm sorry?
The market's changed too.
The market's changed too. Yes, it has.
Yeah.
Great. Anything else? Nope. Thank you. The AAA meeting last month, just briefly, we had representatives from the Lions AAA people talk about their situation up there. The 2,130 residents in Lions, 12% of which are 65 and above. However, there's 1,300 adults in Lions, which puts the 65 over at 20% of their population. So it's a significant number in a very small town. They have Meals on Wheels. They have a delivery system up there, but most of the food people come to their care center, Walter Self Center, to get meals and whatever. Project Angel Heart is there. They deliver medically supervised meals to people in need. Interesting to see such a different scale of what we do here compared to it's a much smaller city, but what they do up there to serve their population is pretty wonderful. The rest of my report is the current bills that AAA thought would have an effect on seniors. If you take a look at that, specifically older adult support and representation of the workforce, near and dear to Dave and John's heart, housing development, etc., and also some on vulnerable exploitation banking processes. So take a look at those. There's some there that, if you look at Bill HR 261030, data center utilization, these centers that are going up to support AI, whatever incredible demands on power and impacts on neighborhoods. That was pretty much it. John?
Yeah,
Wanna-
so, keeping on. So Friends, it looked like Friends added, similar to what Katie said, they had about $100,000 based on return on investments that was stock sales that converted to cash. So financially, the bottom line financially was, they're still at around 2.9 million, so they're pretty stable in that regard. I got Ronnie wrong a little bit. I thought the two new hires were on the recreation side. One was on the recreation side, and one was the assistant staffing position for the office. Branding, a lot of the discussion during the Friends meeting was on branding. Branded Beat is the organization they used for that. There was a pretty extensive questionnaire that was released. They're trying to gather as much data and thoughts on what makes sense from a rebranding perspective for Friends. So that seems to be pretty well underway. Ruth Walkaw is heading up a recruitment effort. They're trying to get people that are that have specific expertise, whether that be fundraising, whether that be treasury management, accounting, that type of thing, rather than just general purpose guys like myself. The CRM system, I just asked Donna before the meeting, it sounded like they had training yesterday on that. They call their CRM system Network for Good. That's being brought online. John, you were probably there, I would imagine.
It was.
So I
As
thought
was Denise and Laura, so.
Yeah, so I thought I could kind of finish up, maybe get your perspective on how the training went yesterday and what you think of the CRM system, if you don't mind.
Well, I ran the training.
Okay.
It is an amazing system, Network for Good, which is under the umbrella of Bonterra nationally. And it's amazing what that system can do for us. For example, in creating an email blast, you tell Bonterra Q what you need, and it creates that blast for you within minutes. And they also have 140-some thousand templates of successful campaigns that other not-for-profits have used throughout the country that you can take advantage of in developing communication with your client base. And it also helps with looking at that client base and keeping track of who's donated, who has lapsed donations, and what did you guys think of the training? Since I ran it, I'm not very subjective or objective.
I was a little overwhelmed by how much there was there, but it was comfortable overwhelmed because it's so clear on how to approach different things. We're going to try a mailing out here for Older Americans Month in May, and so we're kind of wrestling with, well, what should we talk about? So Laura puts in Older American Month, beep, up popped this, there's our program. It was so simple to do, and I don't do computers, even I can do it. So really impressed, and this is a 6-7 months of work to look at vendors, to go through the program, and Laura and Donna have been working pretty hard to onboard Denise. So there's just a lot of work that's going to really benefit the Friends, which obviously will benefit what we're doing here.
So in John's example, does that then go hit a database?
Well, we have the
in the cloud?
database.
Yeah, you need a local database, right?
Yeah, well, it's in Network for Good is our data, where we've input our information. And,
But for John's query, did he just?
It's a cloud-based.
That goes up to the
It's
cloud?
our database, and we don't share that with anybody else.
Right.
It's our database, but it's cloud-based.
To construct that campaign he just talked about.
Right.
It's going up to some AI cloud that's,
Mhm.
okay.
which they have really been working, Network for Good with Bonterra has this last year been incredibly security conscious, and they just updated the system again too. So that's comforting as well. And one thing is with Network for Good in Bonterra is their training program is incredibly robust. There's, I'd say, 3 to 4 trainings per month that are live, and then they have training in their system as well on fundraising and
Creating emails or creating newsletters or whatever you could. Network for Good is focused only on nonprofit organizations.
and
So-
smaller nonprofit
And smaller, yeah,
organizations.
it's very targeted to that. So the learning that people make, they can voluntarily allow the template that they've created to do a newsletter. They can volunteer to let that exist. People can come in and take that template and then put their own logo on it, replace the photography that's in it with their photography, change the words up, or do a whole new write-up, whatever. And then, but it cuts in half what a staff person or an individual would take hours and hours to do down to a half an hour. If you, once you know what you're doing, and that takes a little bit of training, but it doesn't take years of training to do it. It's so
Instead of
simple.
hours, is a half.
It's so
an hour.
simple now.
Yeah.
No
From beginning to
programming
end.
required.
Yep.
Anything else, John?
I don't know where this, just an FYI, this, well, it'll affect everyone, but it could definitely affect seniors. So obviously scams, cybersecurity issues, we talked about that earlier with your husband, Mike. The SEC is not approving new router certifications, network routers for home use. And they'll stop, unless something changes, they'll stop approving updates to existing routers in March of 2027. So hopefully that changes. I believe that will change. If that didn't change, it means the bulk of routers out there in about a year would no longer receive security updates. So I'm kind of keeping an eye on this. I'm sure Mike is to see what's going on here, because obviously seniors are not known for oftentimes being up to date on their stuff, and
I just want to say, what you're telling
That's
me now,
generous.
I know from Mike as well. That's things that the general public aren't grasping yet. And so
No.
they need somebody to tell them
yeah,
that they can
but-
trust, you know.
But I think right now, it's like you're shooting yourself in the foot, right? Because if you don't provide some way for tens of millions of routers to be updated in a year, thinking that anybody's gonna just throw their router out, especially seniors that are on a fixed income, right? Or anybody on fixed income is pretty ludicrous, so, so anyway, I think it's let's monitor the situation and see what happens, because that's not gonna work.
Thank you for that. Eric?
Nothing
Sustainability?
on sustainability, except we're having a live meeting next month on May 7th.
Wow.
And we
You
only
don't do live meetings.
a couple a year, so it's sort of exciting. I get to meet my compatriots on the sustainability side.
Taylor Swift is headlining.
No. Anyway, so that's all I got there.
Okay. John and Dave, employment?
Yeah. All right. Dave, you want me to start, or you want to start with some stuff that you have?
Go ahead.
Go ahead, okay. So.
I gotta
Dave-
say, everybody, that John's taking the lead on this. Done a good job.
Thanks. It's team effort, trust me. So we met with Scott Yellow. You might remember Scott from last time when they gave their presentation from Marcom. We met with Scott and we wanted to talk about the senior employment webpage that's on the broader Longmont, Colorado website. And wanted to see what we could do to bring additional exposure on that page to employment opportunities. And so we talked about an email sign up, because right now if you sign up for the newsletter, one of the boxes you can check is on employment opportunities. So we wanted to get more exposure to the sign up page. And then the second one was parks and open space trails. That would actually be more of a volunteer opportunity, because there are some seniors that need to work for income. There's other ones that want to volunteer, like us, right? And then the third one was the link to volunteer opportunities, including the youth center. So one thing we talked about, I put a little box here. We could potentially create a new box on the senior drop site, and then have, if you click on that box, then it brings up a couple of different options, whether it's volunteering, whether it's the newsletter, or whether it's employment. For the employment, what we talked about was having that link to the City of Longmont's employment webpage for now. This webpage is being updated, Scott said. When did I say that? I think it's going to be updated in April. So we're going to circle back around with Scott at the end of April, see what the webpage looks like, and then see what we could do to go ahead and get that box added to the senior. He said it would be a pretty simple effort. It's not again, the tools for web design are so far advanced now. He said he could probably whip something up. Of course, he'd have to get approval. So Ronnie, he did mention that whatever we decide that we want to try to do, we want to run that by you, get your input, see if that's something that you're comfortable with. And if you are, then we would go ahead. He said he could get it implemented fairly quickly. Any questions on that? The next one was there's a workforce. Boulder County Workforce is having a workshop. They call it, I think, the Northern Colorado, Wyoming workshop. It's going to be held actually at Boulder Workforce here on Kaufman Street. That'll be held, I think, April 30th, as I recall. And we haven't seen a flyer yet on it. We've had some communication with Lori Moon over there. As far as we know, it's still taking place. We're just waiting, because she said once the flyers are distributed, then we can get a bunch of those flyers that we can go here, that we can put here at the senior center, and then start promoting it to our seniors to attend that workshop. The last thing that Dave and I talked about is the job fair. That we believe that's still tentatively being planned for the fall here. I don't know, Ronnie, if you've got any update from Brandy on that. We haven't really spoken to her recently.
I have not.
Other than we believe it's still happening. I'll make a note here to get a hold of Brandy to see if she has any updates on it.
I could do that. I'll put that in my notes.
Okay, thanks, Ron. Thanks, Ron. And also, if you could let her know if there's any assistance she needs at all. You know, Dave, and I'm sure others would be willing to help out if she needs any. If not, that's great too, but just to let you know. The last thing I'll say is this whole thing with this website, I think I mentioned it earlier, it's internal for now, makes it really easy, right? Internal job opportunities, internal volunteer opportunities, stuff that we control within our domain. But Scott made it pretty clear that we could extend this potentially to external sites, external job sites. So we want to start kind of brainstorming once we get our feet wet internally as to what we might want to do to expand this thing externally where it makes sense. So that's something we're going to discuss.
Do you have any examples of where you might, what that means?
Well, yeah, so an example could be workforce, older workforce.
Okay.
Would be one example. The Colorado Colorado Division of Labor. Is it the right term? I think it's Colorado Division of Labor. They operate their own website and they have access to jobs in the state of Colorado, and then you can narrow that down to other, Boulder County as an example, or different types of jobs. So that might be another one, Division of Labor.
The AAA's having their meeting this Friday. I'll see if there's any resources there they may know of.
Okay.
Check back with you and Dave.
Okay.
Great. Anything else? Okay. Dave?
LinkedIn.
We're just saying, can you connect with LinkedIn to create something there?
I don't know.
Good question. Dave, anything on advocacy?
Yeah, I got a bunch of things.
The floor is yours.
Yeah, we're moving along here pretty good, and you're gonna have to stop me if I get going to talk too much.
I got the timer on. I got the timer on. Go.
Yeah.
Start talking.
I've been told I talk too much. I should have said maybe I have some things to get off my chest rather than things to talk about. Maybe it's a little bit of both. I'm not really complaining, don't get me wrong. This board advocacy approach that I guess I'm the one that came up with it, where we would approach city council members and attend coffee with council as a means to, improve and connect with the people that are important to us. I'm a little frustrated with it, I'll put it that way. At the last coffee with the council, I didn't really prepare a report there because there were so many things that, it was a good discussion, but it didn't have a whole lot to do with the senior center. And so, you spend a fair amount of time talking about different kinds of issues, and they're not really relevant. I will say afterwards, I talked to Diane Christ for just a few minutes, and I'm not quite sure that that's the right approach. I'm just thinking about that. If you got some ideas, let me know, because what happened was I introduced myself. I had already sent her an email asking if I could meet with her and talk about the senior center and those kinds of things. And she never did, she didn't answer my email, and it was probably bad timing. It was probably not a good approach on my part because we didn't really talk much, and I think the circumstance was that, there was a lot of people in the room, a lot of people wanted to talk to her. So that didn't really work very well as far as trying to approach her, to just talk to her. So, so far I have contacted four of the city council members, and one of them, Jake Marsing, I finally got connected with him a couple, 3 days ago, and we had a conversation. And I was telling John earlier that he is really enthusiastic. He seems to be very supportive, very enthusiastic as far as what we do, and as far as the needs and being aware of the needs of seniors. I think he is truly sincere, and when he says he's interested in the seniors, and I think he's going to be very helpful. in the future as I get to know them, as the rest of us get to know them. And what I'm thinking now is we pick out the people, I guess this is obvious, but we pick out the people on the city council that are most supportive of the senior center and concentrate on them, and I think he is one of them. So I'm not giving up, don't get me wrong, I'm not giving up on approaching the city council members, trying to get to know them, but it's been kind of a tough slog. It's been a little tougher than I thought it would be. I thought maybe I could just say I'd like to meet with you for an hour or so, and they'd be happy to meet with me, and I'd tell them all kinds of things, and we'd be buddies. No, it's not. It doesn't seem to be working that well. Call me naive, whatever. But it's, I'm working on it. I'll continue to go to the coffee with the council members. I will continue to try to get to know the council members, and I will try to meet with them. And so I'll keep you posted on that, but that's about where it's at.
Dave, can I just
talk to Jake?
Dave, can I jump in for 1 second on this?
I'm sorry?
Can I jump in for 1 second on this?
Sure.
I will say I appreciate your perseverance. Don't give up. I will say from personal experience that the last 6 weeks on city council were some of the busiest I have had in terms
I've been told that.
things going on. Major projects that are public now, the Front Range Community College partnership. We were supposed to have an off week last night other than the Urban Renewal Authority meeting, but that was a 4-hour meeting because of multiple things that needed to be approved around the First and Main Transit Station, Front Range Community College, Old Walmart site development. Then we had the public safety conversation and technology study session. That was a very long meeting as well. 4 of us were in DC for most of the week in the middle of March for the National League of Cities. And we had the city council retreat, which were 2 full days this past Friday and Saturday. So March in particular was pretty booked up. And you don't want to see my calendar. But do continue your outreach efforts. I know that there are folks who are interested.
Yeah, I do admit that I was a little frustrated, and I even complained to a couple of people, but that's what they told me. They said you guys have been just absolutely swamped.
And I don't say that to make an excuse per se.
It really kind of is.
But in this case, it was a particularly hectic period and dense period, if you will. So.
And I'll look forward to seeing you on the 18th because I'm the staff liaison that takes notes that day. So
Okay, I'm sorry.
I'll be there for coffee with council on April 18th.
Yes.
I'm the staff liaison, so if you're there, I'll be happy to see a friendly face.
Oh, okay, all right.
Matthew, any suggestions on how we might do this a little differently with the council? I know they're busy and there's lots of issues.
Yeah.
Any suggestions on how to streamline that? For myself, I know that the food table, we have typically 4 council members in there, 3 or 4 typically, obviously supporting what's going on here. Any suggestions on how Dave and...
What's the best way to get texting or email? Because I know some people, like, I'm a text person, I respond better to text than anything.
Yeah, I think considering this is coming from the board, I think email is the most appropriate for a couple reasons, just from a open meetings and coordination approach there. I think,
It might vary from person to person.
That's what I was going to say. It's going to vary from person to person. I respond to both personally. I use both options very consistently. Some people work through things at different paces and different times or different approaches to how they do that. I'd say give it another month and see if things change in the next.
I'll keep plugging.
Yeah.
I'll keep plugging.
Yes.
Okay.
I'm still digging myself out of my own holes from my email box too. So.
Hey, do you invite them? Do you, just like, Matthew and Susie and Sean have come to the food distribution?
Mm-hmm.
The other ones, have you invited them to come to the senior center and observe it?
Well, actually,
so they know
when I
and
talked to
believe
Diane
what they
Chris-
hear, but for, vision to
That's a good idea.
come and check it out.
Yeah.
Sit on a class or whatever.
Well, one thing that happened, I didn't follow up on it, to be honest with you, but when I was talking to Diane Christ, I wasn't prepared to talk about, for the situation, okay? And I wound up asking her if she would come to our board meeting, and she said she would. And so if that's the sort of thing that you're talking about, there's at least one person that I bet most of them would come. And that would be a good way of educating them, I think. Maybe that would be the best way of doing it, I don't know.
Well, the other, I think what I hear from Marta is invite them specifically to the next food distribution. And maybe say, hey, can I meet with you 30 minutes before it starts?
Yeah.
And then off to the side.
I kind of dragging my feet on that a little bit, but I don't know why exactly. I guess I'm kind of bashful and I'm kind of shy. I just.
Well, don't be.
If you're too bashful, we're gonna sick Marta on.
They can come into the different programs of the Spanish speaking, the other ones, what they do, and sit. Maybe they'll put them to meet or whatever, but there's nothing wrong with it. They can see what this center is doing. So they just don't hear and say, oh, but we're in Peru. Well, let's see, check it out. Yeah, I know. Not gonna hurt him.
Well, yeah, I'm open to ideas, and I don't have to be the only one, you know. Anybody can. That's ma'am.
I have a question for you. Are you trying to educate them?
Yes.
Okay. Or are you asking them for something?
Yes.
Which is your priority right now?
Just getting to talk to them at this point, but let me give you an example of my conversation with Jake. I started the conversation by just saying, what is it that you would like to know about? Is there certain kinds of information, a certain kind of information that would be useful to you in making your decisions relative, any decisions that you might make relative to the senior center? And so that's mainly what I'm doing, and his response was, I'm paraphrasing it, but he said something like, I like the big picture. What's the broad scope? What are the implications? What are the things that go into aging in place? You know, he wanted to know the big story. You know, he wasn't too concerned about the little things. He thought that, you know, our annual presentation that we've been doing now for what, two years, is that he thinks those are useful and interesting and everything. But it's kind of like when it's over, we'll see you next year. And there has to be some more continuity and more follow-up. And one of the things I was impressed with, he told me, I don't know how many times, call me, but anytime, you know, we can talk about things like this. And so, one of the things we did talk about was, I said, a lot of people know, everybody knows, that the population of older citizens is increasing proportionately. Everybody knows that. But not everybody knows that within that group, there's a higher proportion of people that are working longer than used to be, and more people need more income than they used to, because things are tougher these days. So that's a change in the demographic that has policy implications. And I think you could bring that right back here to the board, and we want to make some policy recommendations to the council about that kind of an issue. And I think we should, but we're just not ready, you know, to do that yet. So, you know, I'm not answering your question very well, but I guess the thing is it varies so far, you know.
I guess what I'm getting to is you right now your communication tool is yourself, your voice,
Yes.
and getting their attention. You may want to consider, since I don't think you have a website.
No.
Senior Advisory Board doesn't have its own website or anything like that. So your communication tool is going to be paper.
Yes.
So creating a brochure or a fact sheet or something like that that has a condensed version of the worldview, and then either frequently asked questions or implications thereof of what's going on specific to, and you can leave that behind with contact information that would be one of the good ways of getting people's attention, because you've got to develop that elevator speech that catches their attention. But the leave behind is really important, because they'll put it in their pocket, throw it in their purse, whatever, briefcase, and then something will come up, and Nat can probably attest to this.
Nothing comes up ever.
Something will come up in some random meeting 3 days later, and they'll go,
Bingo.
bing.
Yeah.
I'll build on that. One thing to think about when you're approaching these conversations that I encourage, I mean, I used to be a professional consultant and lobbyist for cities before kind of their priorities to state and federal governments. And one thing that I would often encourage cities to do when they're going into those meetings, I think the same logic applies here. 2 to 3 things that you want someone to walk away from that conversation remembering. Start there. Doesn't have to be super detailed. Doesn't have to be what the population of New Zealand is. It can be, what's one thing about the senior center that people don't appreciate as much? What's the trend that's happening to seniors in Longmont that you want council members to be aware of, and what's something that's coming up that people are concerned about, or what's something you're doing that you're proud of. Whatever that issue is or topic could be a good way to frame that conversation.
Yeah.
There's a reason phone numbers are set up in 3 to 4 digit sequences. It's easier for the brain to remember too. In those kinds of chunks, and so maybe approaching it of like, what at a minimum, what are those 2 to 3 things that you want people to think about?
Did you put it
What
on
he
your
said.
paper? No, that's where I was going, so
Yeah.
I appreciate it.
Yeah, and I'm kind of getting there, and I'm going to talk about something along those lines in a couple minutes. But those are good comments. That's very helpful, because.
But rather than having random contact like that, where you're just constantly binging off, and people, because everybody is so busy, people don't necessarily remember what you said to them last. But if they have something in their hand, it's got your name on it and your phone number, your email address, and all of that kind of thing, then if something happens that brings it up, they'll come back to you, because they know you know a lot more than what's on that sheet of paper.
Sorry, what were we talking about?
Another way I was thinking also, when we start doing that outreach,
Right.
Yeah.
we'll drag one or drag the other, then they take turns, so they can come and hear. They don't know, then they'll learn also, along with the group that we're trying to say, what does a senior center have, what does it have to offer? You're inviting, whatever, so they start learning and be part of the outreach group that we're gonna start doing.
One thing that I mentioned to Lonnie a couple of times in this group, and she's not here today, but as part of the outreach effort, I do think collecting information is just as important. What are the things that are important to the people that we're trying to serve? Not just what we do, what we can do for people, but is there something that we're not doing that they would like to have done? So, kind of input the other way. So, yeah.
And I would just add that, you have Ronnie as your staff liaison.
Yes.
And so as you move forward, to really check in to say, before you create anything, before you go down the path of creating a brochure, doing all that work, to really check in with Ronnie to say, this is what I want to accomplish. What might you already have? What opportunities do you have where I might be able to connect with the council member? Is there anything coming up at the senior center where council is invited that's not the food table? The other thing I will add is that as city council was kind of bidding for their advisory boards that they wanted to be on, there were several city council members that really wanted this board. I think Councilmember Popkin is the lucky one. And so to me that says that the senior voice is a priority. It wasn't like, oh, nobody wanted that advisory board. There were several people that spoke up, right? And so I think keeping it in that frame of mind as well, along with everything else that's on their plate. But I really would encourage you, whether it is meeting with marketing and communication staff, whether it's how do we go about this and how do we get the word out, really utilizing your liaison, because for several reasons. He has that overall view of what's going on in the division and how it might fit in with what staff is working on. But then also you're not reinventing the wheel, would be my recommendation.
Yeah, I want to say, I have no intention of leaving you full south.
Okay. And it really would be Ronnie. It really would be Ronnie. That's
I'm
even.
not going to leave Ronnie out, but for one thing, if something goes wrong, I got somebody to blame.
Yeah, we can blame Ronnie.
Congratulations.
That's always fun. That's always fun. It's always fun.
A couple more things, I'm taking more time than I figured here, but you had one of the bills listed on your Aging Advisory Committee, and I want to talk about that just a little bit more, and this is something I think is worth watching. It's House Bill 261010. That was the first one that John had listed in his report. Bear with me, I'm just going to go through this paragraph. This is the bill summary, and I don't know if it'll ever die. Maybe it'll be dead by the end of the month, who knows? But I'm going to watch it, and I do think that this is the kind of approach the legislature should take, that maybe we should take to, or at least we should try to participate in and try to influence if we can. This bill increases participation, representation, and support of people over 60, and it's requiring the State Workforce Development Council, the Colorado Commission of Aging, and other entities to meet twice a year to collect data on individuals that are in this demographic group. That's 55 and older. And then it would require the Department of Labor and the Department of Human Services to submit a report to the council, that is the council of the Development Council, and then take that report and submit it to the General Assembly, like, before the assembly starts. And the whole idea is to come up with opportunities in the area of employment, and education and apprenticeship, higher education, and in fact, the agencies involved would be the Commission on Higher Education, State Apprenticeship Council, the Commission on Higher Education, the State Board of Community Colleges, Occupational Direction Advisory Committee, all of these in an effort to come up to enhance opportunities for the older worker. And that'll be working its way through the legislature, hopefully. And that's the kind of,
I can just add, it's very much working its way through the legislature. It passed the House in Colorado 47 to 18, and it's just recently been, I guess technically last month it was introduced into the Senate, so in March. So I don't know what the chances are there, but it passed with a fairly substantial majority in the House. And there's no fiscal note with the bill, which means there isn't a financial cost to implementation. What we're generally hearing is that anything with a fiscal note in this budget climate for the state has no chance, and that bills without a fiscal note or very, very low fiscal impact have a much higher likelihood of success.
I brought this up in part, not only because it could be useful to us, but I think this is the kind of thinking that the legislature needs to have, the city council needs to have, as far as that goes, this board needs to have, for the future. One other thing, I'll try to go through this quickly. How many copies do you make?
A dozen.
A dozen? Okay. Maybe a couple of you might have to share. this. Okay. In my opinion, Ronnie said that what did you call me? I love the data or something like that.
Exactly, love data.
I do like that because I was a manager my whole working career. And I depended on stuff like this kind of information, to make decisions. So I was telling Christina and Ronnie yesterday that if I don't have this kind of information, I really get kind of nervous because I don't like to depend on just written, verbal kind of stuff. This, what you have in front of you, is a summary of information taken right out of this Ronnie's last report. Three or four pages, and that he has several reports just like this, going back, I don't know how far back, but at least till 2021 was when I started. So, if you just look at, I'll go through this fast. Services delivered, like again, it's lifted right out of existing data. Under service delivery, you got care given, case management, information referral, and then you have the number of, I think that's the number of individuals, isn't it? Is it not, Ronnie? The number of people involved.
Completion of forms.
And the method of contact.
Completion of forms, top, very top.
The service volume, and then on the backside, you've got the areas of concern. And I'll just pick out a couple of examples. If you look at under service volumes, you can see one-time contacts have gone from, they've generally increased, but for some reason, the number of contacts over 5 or 10 or 11 have decreased the last couple of years. So the question is, why did that happen? Is that due to staffing? Is it due to a change in the clientele, or just what is it? What I'm saying is you can look at this stuff and ask management questions regarding the quantity of work, the kind of work that's being done, and then if there's something we can do, we could make recommendations to the city council on whatever the area might be. Right now, we don't have this kind of information. On the backside, that first one is interesting, financial. You'll see that it has gone from about 2,000, 2,300 down to 1,100, 1,200 this last year. I don't know, there's probably a good explanation for that, but I would ask Ronnie, why is this happening? What's the dynamic here as far as the change in the area of concern? This has implications for staffing. It has implications for resources. It has implications for budget. It has implications for how you allocate resources. Now, I'm not suggesting this as the final copy. What I am suggesting is that I think as a board, we need information like this to consider, maybe bi-monthly or quarterly. Talk about it. And if we talk about it, a couple of things. We'd be educating ourselves as far as what's going on. And secondly, maybe it'd be the basis of some recommendations. So I would just like to introduce that. I'll come back to what to do next. Then,
A couple more minutes.
am I taking too much time?
2 more
2 minutes? Okay, I'll wrap this up quickly. In October of 2023, there was a survey done by the marketing people that asked a bunch of questions. I think it was pretty much of a random sample, I'm not exactly sure. But they asked a bunch of questions like, have you been to the senior center? They broke it down by age group, the reason for attending, and by age groups, and the kinds of programs that are most interested in, and the barriers to employment, not to employment, to the center. And what I'm suggesting is that we do this again. This survey has already been constructed. And all we would need to do is the marketing people could administer it again. I don't know exactly how they do it. And maybe we could add some additional questions given some of the recent developments as far as the labor market is concerned, employment for seniors. I mean, there's all kinds of questions that you could ask. So what I would ask, and I don't know how you want to handle it, I would like to have this on the agenda at the next meeting. And Ronnie, I'd like to have you respond to this at the next meeting, see what you think. I know you've got ideas, I know you've got thoughts, you've got limitations. You told me about some new procedures, some new programs that you have, I don't even know about.
So a couple quick responses.
Sure.
But absolutely. The data that you talked about, the dip in some of the referral supportive services, the volume and the types of, the areas and the type of volume. That is because we're not seeing less seniors. We're still at capacity. That's because of a system, a data system management system. Yeah. So when we shifted from one data, for lack of a better term, a data tracking system to another, we were not able to record that data in that process, if that makes sense. So there's a time where, yes, those services still be providing, but because we're switching systems, it's not capturing all those pieces of data in that process. So this year, and so I shared with Dave, in a conversation yesterday, that the reason why we do our data comparison from the year before, which as he's shown, every single year will show that increases across the board, right? Increases everywhere. But the reason why we don't have it over an extended period of time and we do that year to year is because things like that. Can't compare this year to 3 years ago when it's this year that's causing kind of that disruption and accuracy, if that makes sense. So that's why we just kind of compare year by year. Yeah. What else was I going to say there? But that's a quick response for that one. But as for big picture, the survey, good opportunity for the board to, kind of revisit, consider, we can put on the agenda to start looking for themes, ideas, gives everybody a chance to go back and then come back to the table to really have those ideas, recommendations, and again, those themes really emerge to where we can now look at, okay, yes, this is what we've seen. Councilmember Popke hit on a good point. We always want to keep those questions, and our comms team pointed this out before, as minimal as possible. So being able to take those themes and how do we hit on multiple themes within a single question, if that makes sense. You don't want to overload them with 15, 20 questions, and they'll quickly walk away from that survey and say, you know what, I'd rather go walk in the park or get to my class. But if it's a targeted 5-question survey, absolutely, we can capture a lot of people with that. It's not the comms team that implemented, facilitated it. It was the advisory board. I worked with the advisory board to develop those questions. It was the advisory board who implemented it in our front lobby. We then took those results back to I sorted everything through a spreadsheet and then gave it to comms, and then they made that beautiful spreadsheet for everybody's viewing pleasure.
There's my bottom line. I would like to have something that's acceptable to you, that's useful to the board, and have that talked out, agreed upon, and put in place by the end of the year. That's what I'm talking about. Because right now, we don't have much data available to us.
The board has we have a lot of data. The board has a lot of projects going on. We have working with Boulder County Workforce, right? So multiple projects there, conversations there. We have outreach, looking whole community. There's a project going on there. Maybe there's a way to combine all of these instead of having so many different projects in a short period of time.
I know there's lots of stuff going on.
And maybe there's just a little bit of an easy data compilation packet that you can share for the next in the next board month or two with the board, so that they can see all the information that we do have.
Yeah.
And go from there. Because I think Dave's point is sound here. Like, he wants to have useful data available to help inform the conversations that the board is having and the advice that you're providing to city council and others.
Which, going to your point, Donna, if we, if we put this together in a handy packet, so to speak, we've got it right there.
Or is there a website where all this stuff already lives, or no?
It does.
So maybe we start sharing that too.
The other thing that I will add that I shared with Dave yesterday is that for years and years, the city contracted with an outside agency to gather citywide data and do like an annual or biannual survey. There has been a change there, so where we have taken that in-house in our strategic integration, and that's really in our strategic integration department, and that is really where all of the data and analytics lies for the city as a whole. And so again, I think before going down that path, to your point, Councilmember Hopkins, yes, we can compile all of the different data that we have, but I think it's also important to bring in that department, which Ronnie can do, and bring in Lynn Yarmy, our manager in that department, to talk about this is what the advisory board is seeing, this is what they're recommending. How does that align with the data that we're getting from the city as a whole when we do that survey? There may be things that we're not even thinking about that they can help kind of frame or give us suggestions about how to go about that, because they're really the data and analytics people for the city.
Like I said.
That makes sense. Yeah,
Yes,
that makes sense.
I consider this a starting point,
Absolutely.
but I would like to work towards something that's useful to everybody by the end of the year.
Does everybody have a copy of that? Pull that report up. Does everybody have a copy of that?
I asked the city clerk yesterday if I could have a copy. She said they had one, she would try to find one, and she'd have it to me by the end of the day, but she didn't make it, so I gather she couldn't find it. So I'll keep working on it. Would you like me to send out a copy?
I think it'd be good if you.
Okay, as soon as I get it from the city clerk, Ronnie, why don't I'll send it to you and you can send it out.
Absolutely.
It would be worthwhile, Christina, to have Lynn Yarmy come to one of our meetings.
Let's have Ronnie check in with Lynn and kind of see where what she suggests might be the right place to insert herself, and then whether it's that meeting or a follow-up one, we can let y'all know.
Okay, so get a copy of that distributed. Read what's in there and see how we want to update that, and then come back and at the next board meeting.
Yeah, I'd like to continue the conversation.
Yeah.
It doesn't have to be as lengthy as it was today, but I'd like to kind of keep on it and work with the board, work with the senior center management.
I think the time is well spent. What you've described here will be useful. It's a good start.
Yeah, it's a start.
Okay, so get that on the agenda for the next board meeting. Anything else, John?
John, did you want me to do my report now, or?
That's a great idea. We'd love to do that.
No problem. I definitely didn't want to leave Dave's question from before unanswered as well. So I'll jump in with a couple quick things. We already talked about the City Council retreat, so I'll move on from that. Just a reminder to the board members here, the boards and commissions, the city's application portal for boards and commissions is open again for the next round to fill a vacancy, including with the Senior Citizens Advisory Board. So if you do know anyone who might be a good fit or you'd like to spend more time with, but particularly that would be a good fit for the board, those are due April 24th, and it's the traditional application approach. To Dave's question before on the updates to the interview process, last time I was here I had mentioned that City Council was making some updates, including a more recent proposed change to not have the boards actually make recommendations on specific candidates. That did not actually get incorporated at the end. So boards will still continue to make recommendations. There was back and forth and some pushback that I heard from multiple board members, not just here, but on other boards, and that other council members heard too. So that ultimately did not get passed as part of the other was.
Yeah, thank you for your support.
So that's where that lies. So the biggest change for the interview process this year is that I will be joining as the liaison into the interview process for whatever nominating committee is formed, as I will, not just for the Senior Citizens Board, but for every single committee or board that we are on for the city. So that'll be the biggest change, not to control or direct anything, just to be a fly on the wall. And to be able to represent that process back up to City Council when we're looking at across the boards and commissions. I will not be able to join you all next month in person, much to my chagrin. I will be out of town, so apologies. But that will be a focus, if I understand from this current agenda, on transportation, which I'm more than happy to follow up with anyone on after, but we'll be in good hands with our staff who are going to be presenting on that. Accordingly, I will give you a few transportation updates just to, tickle your fancy for the next meeting. We'll start with what's going to be frustrating. Number one, Hover and 119, that intersection is going to be starting a major overhaul with an overpass over Hover going southbound towards Boulder. That is the north end of that whole 119 corridor project that's happening. But really 3 parts on that. It's the bike trail that you see if you're driving by. It's the bus rapid transit lane integration. That will be the queue jumps, so allowing the buses to get to the front of the lines at lights, and then a major revamp of Hover and 119. Will it be messy? Yes. Will it be productive? Absolutely. It's intended to reduce, is it fatal or reduce crashes in general by 40 to 50%, eliminating many conflict points, shortening pedestrian crossings, achieving more efficiency in peak hour delays as well, because the drivers spend less time idling, improving air quality as well. A lot of benefits. It'll be messy for about 18 months. So prepare yourselves now. That construction is going to probably start, I think, this month. I don't have exact dates and schedule on that, but just wanted you to be informed about what's going on. And it is very much intended. It has been planned for a while, and it's a major, probably one of the biggest intersection overhauls that the Longmont will be seeing for a while. So enjoy. At 3rd and Atwood on the east side of town there, that will be closed from April 6th to 24th. There was a newsletter from the city, a public notice that went out from the city. That's related to the railroad crossing and the quiet zone work that's happening there. That's also been long in the making. So that will actually, that all of 3rd will be, like that part of 3rd and Atwood will be closed. There'll be a detour up to 4th just for 3 weeks, slightly shorter than 18 months. So that's positive direction there. And more positive news, what's opening, the Greenway is set to reopen fully, same for Greenway by end of June from that work that's happening there. There is more work that's planned. It's not budgeted for right now and not funded, so or it's budgeted for but not funded right now. So that we don't know what the next steps of time will look like at that point.
At the coffee with council, the 17th and airport came up as they said that was going to be dealt with at sometime in June? I thought the engineer said.
That is out of my word, and I don't know specifically the details on that intersection as well. I do know that there is work happening at a different part of 17th, just that the intersection just east of there, to include like a flashing beacon for pedestrian crossing up there, like 1 block over. I don't know specifically the 17th and airport as well.
Because a couple people there brought that up because of speeding or whatever, and he said something about work was going to start somewhere near there.
Yeah, I think it's
Jim Hangstaff.
Is that?
Jim Hangstaff.
That was the city engineer, yes.
Oh, okay.
Correct, yeah. He was speaking toward, I think, about the intersection just to the east of that. Again, when you look at traffic and transportation flows, it's a system, right? And so things that happen at 1 or 2 intersections nearby have cascading impacts, sometimes negative, sometimes positive, for surrounding intersections. The Hover 119 impacts there will have positive cascading impacts once it's complete. It will have negative cascading impacts while the construction is underway, for sure.
17th and Airport will be impacted by that one, because I'm sure people will be taking.
I'm sure a lot of intersections will be, yeah. Yeah, but things worth doing are sometimes worth closing for. It won't be closed, to be clear. Like you will still be able to use that intersection. They'll be just rerouting and some shifts in traffic patterns while they figure that out. Frankly, I've been very pleased with how smooth the 119 construction has been going. I mean, they have a few closures and adjustments, but they communicated well, and they've been, traffic patterns generally seem to be flowing still, so that's encouraging. And then the last big thing that I wanted to put on this board's radar, just in case it's of interest, the Front Range passenger rail. There'll be an information session at the Longmont Museum on April 8th, my birthday, from 6 to 7:30 p.m. That is an info session that is not city run. That is a regional, I think it's the Northwest Metro Cities Coalition discussion on what's being planned for the Front Range passenger rail. So if you're curious more to learn about that, 6 p.m. Longmont Museum, April 8th. There are 2 others in April, one in Boulder and one in Westminster. If you can't make that date, you can find that information online as well. I think it's the 15th in Boulder and the 29th in Westminster. Longmont Museum is most likely the most convenient for you. I think that's all I have. So enjoy those transportation updates as food for thought for your next meeting with the transportation folks.
Thank you. Eric, food table?
Food table, next food table is April 11th. Last in March, we had 70 families and 194 people. I need to know if you know now if you're going to be able to volunteer.
Yep.
Okay. John. Okay. Tina, does Mike come with you? Okay.
Yeah, go ahead and put him down. He may not be the whole time, but.
Okay. John, Denise.
I'm good.
John, Denise.
Yeah, John.
All right, anything else?
That's all.
Thank you.
Open item?
Go through
Table?
Yeah.
Oh, I didn't.
You see anything else under open discussion? Future agenda items?
Yes.
All right, go ahead.
I want to tell a very quick story on Lonnie,
Quick. go
because I
ahead.
think it's important that you all know this. A couple of weeks ago, I mentioned to her that we were needing more donations to the food carts that are out in the hallway. And Lonnie said, well, I'll post something on next door. And I said, oh, that's great. So we worked up some words, she posted it, and we got a few people bringing in 2 or 3 things or whatever, which was great. But one of the things we got was a lady from Lafayette who had seen it. And she may live up here. I don't know anything about her other than she saw the post. And she responded to Lonnie, who then connected me to her. And as it turned out, she was a volunteer at Sister Carmen, which is down in Lafayette, and serves that area. They do a lot of the same things that the senior center does, except it's community-wide, and it's a full organization. I mean, it's quite an operation. On Monday afternoon, Denise and I went down there to meet the people, because what they did was to donate to us 7 cases of green beans and 7 cases of black beans. So we have a lot of green beans and black beans that are going out on the food cart. So you'll notice that. Enjoy, to take advantage of it. But we went down there just to meet them, to thank them, and to see, because there was hints in the emails, there were hints that we could probably help you out a little bit, because we get overages down here. And in particular, you're going to laugh, in particular they mentioned Depends. They got a lot of Depends. Could we use some? We can't, because we don't have the space. But anyway, we went down, met the people. We left there with 14 cases of things. 7 cases of oatmeal, 7 cases of rice and lentils. So now we have those going on the food cart. And we had 6 boxes of Depends, which we dropped off at the Hour Center on our way back into town. And with all goodwill and everything, I'm going to send a thank you card. That was what I got, the thank you card from John, to send a thank you and everything. And we'll be making regular trips down there right now we don't have a time frame exactly, but to shop in their overage area, and which they will give to other organizations like ours, so that our food cart will have a supply of whatever Sister Carmen has an overage in, which should be interesting. It should be things that are going to be useful. But this was all because of Lonnie's effort and her willingness to be proactive and post that out on a neighborhood social media post. So it was wonderful. It shows how, you know, communities can cooperate in a very intentional way, but it's not official. It's not the city of Longmont cooperating with the city of Lafayette. It's two organizations and people who are willing to go kind of literally the extra mile down there to go get it. But Lonnie is the one who was instrumental in causing that to happen. And so I wanted to recognize her within this board meeting that you know, she did a wonderful thing. And I appreciate it greatly.
So I would add to that Sister Carmen is basically the sister organization to our center, the Family Resource Center.
Yes, that's true.
And so what I would suggest is that probably Mark and Suzanne, their CEOs, know that this exchange is happening, just so that there won't be any perception of like Sister Carmen stepping on our center's toes. Just bigger picture, I would just say, hey, just so everybody's on the same level, because I know that our family resource centers are really stretched for resources, and I would just hate for that dynamic to play itself out. And they work very, very well with each other, but I just think for them to know that that's happening, that we're getting resources from Sister Carmen and dropping them off at our center. I just think that's an important dynamic, that they know what is happening.
Okay.
Agreed that's a really,
Again, that was an informal.
that's a really informal and a great way to kind of problem solve. And I think bigger picture wise, the two organizations, their leadership probably needs to know that that's happening.
Should we notify Elaine? Elaine
Um,
should be part of that process.
who?
Elaine, based on.
Elaine, possibly Elaine or Mark and Suzanne, just they have a program staff that would know that. I don't know. I'll just get an email together between Suzanne and Mark and copy you on that, John, so that everybody's on the same page.
To that point, when we started the food table, there was some discussion because
Exactly, you were.
cross-purpose on some
Yes.
donations, so that's a great idea.
Yeah. There was, just to make sure that it's all on the same
Well,
page.
does Elaine have a last name?
I'll give it
Elaine
to you.
Klotz.
I'm sorry?
I've got it, I'll give it to you.
Okay, because there's a volunteer who is a friend of mine who is also named Elaine, and she's the one who directed me toward the hour center, so that they could always use the events.
Elaine is the development director. I'll copy Elaine
Yeah, I
on
haven't
this
been in
too.
touch with any
Yeah.
officials. The Sister
That's
Carmen
important.
people are well aware
So you'll send
that
it,
we
send it
dropped
out.
the depends off with the hour center, and they were cool with that. That was not a problem for them.
So Christina's gonna
And, you know, if
drop a note to Mark.
I'm surprised they're not talking to each other. right now.
Well, they
There's so much going on.
there's so much going on, just in their, just with trying to make ends meet there. The organizations, I think, just across the board, have been impacted by funding loss. Just, federal, state, funding, and so I just
this
think
was
it's
in their
important not to
overage,
get,
right?
Yeah,
not to
this
get
is
in the
all
weeds,
over.
just with the same.
We're not taking
Yes.
resources from any place.
This was from their overage
They had an
area.
overage.
It's
That's
just,
important
it's
to
mostly
state.
perception, just to make sure we're serving the same constituency. It's pretty straightforward.
But I would make
Not
sure that
wanting to
gets
get
stated.
into the politics of the situation, what I really wanted to do here was to recognize Lonnie, who is not with us today because she's having surgery, right?
Right.
So so that it, just something that, you know, a group of us got together, we decided that we'd try this and see what came out of it. That this was a bluebird as far as that goes. We did not expect an organization to reach out, but rather we were looking for individuals to bring toasted peanut butter crackers. You know, just so that we have things for the food cart.
Well, thank speaking of Lonnie, did everyone sign this card for her? Great. All right.
And Sister Carmen did reach out.
Anything else?
So it was-
Right, it's just about making sure that everybody's on the same page.
All right. Don't call for
I'll be happy to
motion to
do that
adjourn.
one if I get, yeah.
I'll
John.
adjourn.
Thank you.
So-
Mark,